If your doctor told you your blood pressure was normal today, I need you to stop trusting that number for the next 10 minutes. Because what counts as normal blood pressure for a 70-year-old is not what most doctors are actually telling their patients, and this one gap in communication is quietly sending older adults to the emergency room. I'm Dr. Sara Michelle, and today I'm going to give you the real numbers, the ones backed by the actual clinical trials, not the outdated charts still hanging on your doctor's wall from 20 years ago. Here's the first thing that's going to surprise you. For decades, we were taught that 120/80 is the gold standard for everyone, no matter your age. But if you're over 65 and someone pushes you toward that exact number aggressively with medication, you could actually be putting yourself at higher risk of falls, dizziness, and even cognitive decline. Yes, you heard that right. Chasing a perfect number too hard can backfire. Stay with me, because by the end of this video you'll know exactly what range you should be aiming for based on your real age and health status, not a one-size-fits-all chart. Let's talk about why age changes everything here. As we get older, our blood vessels naturally stiffen. They lose some of that youthful elasticity that once let them expand and contract smoothly with every heartbeat. This stiffening is why systolic pressure, that's the top number, tends to creep up with age, even in people who eat well and exercise. It's not always a sign you're doing something wrong. Sometimes it's simply biology. But here's the twist almost nobody explains clearly. The goal isn't to fight biology into submission, it's to manage it intelligently, so you protect your heart without starving your brain and kidneys of the blood flow they need. So, what is the actual target? For most adults over 65 who are otherwise healthy and living independently, major guidelines now point to a systolic goal generally under 130, sometimes with a bit more flexibility up to 140, depending on your individual risk factors. For adults over 80, especially those who are frail, living with multiple health conditions, or prone to dizziness, many geriatric specialists now recommend a more cautious target, often closer to 140 to 150 systolic. Why the difference? Because in this group, driving the number down too aggressively has been linked to more falls, more fainting spells, and, in some studies, a higher risk of confusion. Let that sink in for a second. Lower isn't automatically safer once you're in your 80s. Now here's where the truth gets uncomfortable. Many older adults are on multiple blood pressure medications stacked together, sometimes prescribed by different doctors who never actually spoke to each other. And when you combine those medications without reassessing the whole picture, you can end up with blood pressure that drops too low when you stand up. This has a name, orthostatic hypotension, and it is one of the most underdiscussed causes of falls and hip fractures in people over 70. If you've ever felt lightheaded standing up from a chair, I want you to pay very close attention to what I say next, because this could be the missing piece your doctor hasn't connected yet. The second number matters just as much as the first, and almost nobody talks about it. That's your diastolic pressure, the bottom number. In older adults, if diastolic drops too low, generally below 60, it can actually reduce blood flow to the heart muscle itself during the resting phase between beats. This creates something researchers call the J-curve effect, where both very high and very low diastolic pressure are linked to worse outcomes. So if your top number looks great, but your bottom number is unusually low, that is not automatically a win. This is exactly the kind of detail that gets lost when blood pressure is reduced to just one number on a screen. Let's talk about the symptoms that quietly signal something is off, because high blood pressure earned its nickname, the silent killer, for a reason. Most people feel nothing until something goes seriously wrong. But there are subtle clues worth watching for: persistent morning headaches, unexplained fatigue by early afternoon, mild blurring of vision, or a faint ringing in the ears. None of these alone confirm a blood pressure problem, but together, especially if they're new, they're worth a conversation with your doctor and a proper home monitoring routine, not just a single reading taken once a year in a rushed appointment. And speaking of readings, here's a mistake I see constantly, even in people who are otherwise very health conscious. A single blood pressure reading taken in a doctor's office is often misleading. It's called white coat hypertension, and it happens because the stress of the appointment itself temporarily raises your numbers. The far more reliable approach, especially for older adults, is home monitoring, same arm, same time of day, seated with your back supported, feet flat on the floor, done twice a day for about a week before any major medication decision is made. If your doctor is adjusting your prescription based on one nervous 15-minute office visit, you deserve a more complete picture than that. Now let's get into what actually moves the needle, because medication is only part of this story. Sodium reduction remains one of the most powerful tools we have, but here's the nuance most videos skip: it's not just table salt. The vast majority of sodium in the average American diet comes from processed and packaged foods, deli meats, canned soups, and restaurant meals, not the shaker on your table. Simply switching from processed foods to whole foods can lower systolic pressure meaningfully within just a few weeks, often before any medication adjustment is even needed. Potassium-rich foods deserve equal attention, and this is where the food as medicine approach really shines. Foods like leafy greens, beans, bananas, and sweet potatoes help your kidneys flush out excess sodium more efficiently, which in turn helps blood vessels relax. Think of sodium and potassium as two ends of a seesaw. It's not just about lowering one, it's about balancing both. This is one of the simplest, most overlooked shifts an older adult can make, and it doesn't require giving up flavor or joy at the dinner table. Movement matters more than most people expect too, but not in the way you'd think. You don't need intense cardio sessions to see real benefits. Research consistently shows that something as simple as a brisk 20 to 30-minute walk most days of the week can lower systolic pressure by a measurable amount, and combined with light resistance training twice a week, it also helps protect against the muscle loss that makes falls more dangerous in the first place. This is about building a body that's resilient, not just chasing a number on a cuff. Sleep is the piece almost nobody connects to blood pressure, and it deserves far more attention than it gets. Untreated sleep apnea, which becomes more common with age, is strongly linked to blood pressure that refuses to come down even with medication. If you or someone you love snores heavily, gasps during sleep, or wakes up exhausted despite a full night in bed, that's not just an annoyance to ignore. It could be the hidden reason blood pressure numbers won't budge no matter what else changes. Stress deserves a mention too, because chronic stress keeps your body producing hormones that constrict blood vessels and elevate heart rate over time. This doesn't mean you need to eliminate all stress from your life. That's not realistic for anyone. But even simple practices, slow breathing for a few minutes a day, time in nature, staying connected with people you love, have been shown in research to modestly but meaningfully support healthier blood pressure over the long term. So let's bring this all together, because I want you to walk away from this video with real clarity, not more confusion. If you're over 65 and generally healthy, a systolic target generally under 130, with some flexibility toward 140, depending on your doctor's guidance, is a reasonable, well-supported goal. If you're over 80 or living with frailty or multiple conditions, a slightly higher, more cautious target often serves you better and more safely. Watch your bottom number too, not just the top one. Monitor at home, not just once a year in an office visit. And remember that food, movement, sleep, and stress are not side notes. They are central to this entire picture. If this video gave you a piece of information you didn't have 5 minutes ago, that's exactly why I make these. Talk to your doctor about your personal target based on your specific health history, because this video is educational, not a replacement for personalized medical care. Subscribe if you want more honest, research-backed conversations about the health questions that actually matter as we age, and I'll see you in the next one.